Alright, so what we have here is the spinal cord model. The most important thing to do when you're approaching the spinal cord model is first off pick out your landmarks. Your landmarks are either going to be your dorsal root ganglion or your anterior median fissure. Alright, the important part about this, and the reason you do that, is that this determines the side of the spinal cord that you're looking at, because one of the things that you'll notice if you look at the list associated with the spinal cord model is that most of the features are named for the side they're on, as well as whether they're white or gray. Okay, going through the list, if we look at the dorsal root ganglion, the idea is it's a part of the dorsal root, which is this larger structure. Opposite to that is the ventral root, right here. You can see that the two of those guys connect here into the spinal nerve. All right, going back to the major part of the spinal cord, you can see that we have a lighter color on the outside, a greenish gray on the inside. This is the white matter on the outside, the gray matter on the inside. The gray matter is divided up into certain projections. The projections are on the same side of the dorsal root ganglion. We have the posterior gray horn, this structure. Toward the side we have the lateral gray horn, and over here we have the anterior gray horn. Again, you can pick that out because it's on the anterior median fissure. These horns are what separates out the white matter. Okay. The idea is that if you go from this stripe, which is the posterior median sulcus, and you go to the tip of the posterior gray horn, what you would have would be one of the two posterior white columns. From the tip of the posterior gray horn to the tip of the anterior gray horn, the white through that area would be the lateral white column. And from the tip of the anterior gray horn to the anterior median fissure, that small area would be the anterior white column. Going back to the gray matter, the idea with the gray matter is that it is full of cells that have a functional unity. What I mean by that is that there are groups of cells here that have a common function. Remember, when we talk about the nervous system, we can substitute the word nuclei for groups of cells with a common function. So if we look at the anterior gray horn, the one that's closest to the ventral root, as we discussed in lecture, this is going to be a motor nuclei. Specifically, this is the somatic motor nuclei. Okay? In other words, it has a group of cells that is dealing with somatic motor signals. This, in fact, would be where the lower motor neuron would be leaving if we're talking about the somatic nervous system. This is the lateral gray horn again, and this would contain the visceral motor nuclei. Again, the idea is that every preganglionic neuron that we talked about with the sympathetic system would be exiting from here, again, to go into the ventral root. So again, very proximate, very close to that ventral root, so definitely a motor, but in this case, the visceral motor nuclei. In the posterior horn, the idea is we've actually got two separate nuclei. If I leave exposed just the tip, okay, that is actually going to be the somatic sensory nuclei, okay, and if I cover up the tip and leave just exposed the base of that posterior gray horn, the idea is that would be the visceral motor nuclei. Okay, again, I'm sorry, not motor, but visceral sensory. Okay, visceral sensory is at the base. The idea is that both of those sensory nuclei, okay, are both within that posterior gray horn, and that horn is definitely close to the dorsal root. And the idea is, again, this is dedicated to sensory. So again, the somatic sensory nuclei, the visceral sensory nuclei, visceral motor nuclei, somatic motor nuclei. So all the sensories are in the back, all the motors are in the front, and we've got somatic, visceral, visceral, somatic. Okay, so kind of a nice sandwich. Last bit here is our connections from left to right. Those are the commissures. Okay, the idea is it's named simply for anatomical position and color. So between the anterior median fissure and the beginning of the gray matter, that strip of white is the anterior white commissure. Okay, what we have here between the anterior white commissure and where the central canal is in the gray matter, that is going to be the anterior gray commissure. Behind the central canal, that strip of gray is the posterior gray commissure. And between the gray matter and the posterior median sulcus, we actually have the posterior white commissure. Okay, that should actually conclude all of the pieces that are on your spinal cord list as far as the model goes.